Whoa, 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 wait a minute. One more thing, the most important thing we forgot. We need your help. It's time for you to name the Quality Improvement video newsletter. So we need you to submit a name. If your entry is selected, you will win 1 hour of paid time off. So submit that entry. Here comes the information to the email.
I can define quality improvement in one word, and it's in the title. It's improvement. Just because something works good now doesn't mean that it can't be better.
Quality improvement is a chance, in my opinion, for PHDMC to move from a, well, that's how we always did it, to more of a, now we've got an opportunity to improve all of those processes.
It's a systematic method of problem solving with measurable results.
Well, to me, quality improvement is an organized way to assess a performance and you want to make improvements on it and track your improvements.
Because I see quality improvement as the means that we show that we're moving forward and getting better. And if you're not moving forward and getting better, that means you're falling behind.
If we're always getting better at what we do as a health department, we're going to make things more efficient, which is going to save money, which is going to improve our programs, and that will in turn improve the health of the community.
I think when people have a buy-in or a say for what the quality improvement is, they're much more willing to follow through with it, and then they also tout it to the other people they work with.
I chose Don't Worry, Be Happy because I think people who know me would say that, yeah, I'm just constantly that way. I still like coming to work after almost 21 years. I love it. I love my job.
I would say Girl on Fire by Alicia Keys.
Katy Perry's Roar. I'm going to leave it at that. Just listen to it and you'll understand where I'm coming from.
Most of the time, I would say it's Taking Care of Business by BTO, and other days it's Help by the Beatles.
When I'm in the car, actually, I'm really, truly not an epic thinker. I tend to listen to books on tape, so I'm typically trying to figure out who done it in my murder mystery, and I save my thinking for the shower.
How I can be a better person, better husband, better dad, and sometimes even a better employee here at Public Health.
When I'm alone in the car, I usually think of how other drivers can improve the quality of their own driving.
I'll be really honest. The whole time I'm driving home and the whole time I'm driving to work, I'm like, what the heck was that car thinking? Does that driver know how to drive?
I would be like Professor X on X-Men. I would be a telepath, be able to read minds. A lot of times you really want to know what people are thinking, and the only way to do that is to be in their heads. So.
I have 3 grown children, and I have 6 grandchildren, so lately they want grandma to do everything, and if I were invisible, maybe they would go away. So I love them to death, I really do, but they want me to do everything.
I would like to have Superman strength, just because I'd like to be able to move heavy objects out of the way, and if I have to, I'd like to break them.
The power to read minds. It would make my job a lot easier in dealing with employees and community partners.
But I would love to be Jeannie from the sitcom I Dream of Jeannie, because I would love to have the power to just blink my eyes and have all my work done for me. Wasn't that fun? I really hope you enjoyed learning more about the quality liaisons. These are the staff that are going to help guide your QI project teams through the improvement process. So next, I want you to learn more about our current projects. 2 of our project team leaders are going to talk about the processes that they're improving. Both of these two teams are using the Plan, Do, Study, Act model. This is the model that we all learned about when we watched the OSU online module, CQI, the Fundamentals.
I'm Larry Kleek. I'm the Emergency Preparedness Coordinator, and I am the lead for our QI project on sending healthcare provider alerts. The main focus of this group was to optimize getting information out to healthcare providers in a timely fashion, but not only healthcare providers, also other key community partners. The specific need is to provide this in a more timely delivery. So we've had 3 specific areas that we've looked at: improving the faxing efficiency, the fax list management, and then the actual approval process. Our team consisted of staff from emergency preparedness, communicable disease, IT, public information, and quality liaisons. Our specific aim for this QI group was to improve our efficiency of providing this vital information to community partners in a timely, efficient fashion. Specific QI tools that we did use included the flow chart, the fishbone diagram, the Gantt chart, and the tree diagram. This group met continuously at least once to twice a month to address all these specific areas.
I'm Kay Andelsek, Supervisor Human Resources, and we have a QI project for staff awareness of personnel policies. The process is to communicate with staff regarding the new and the updated personnel policies. We found that there was a need because there's an administrative need for a signed acknowledgement that lets us know that all staff have read the new policies and understand the new policies. And there was also a staff desire for more communication and a desire to know when there was a new policy and what it was about. So our team, we called it PAR, for Policy Acknowledgement Rock Stars, and it consists of 2 members from the Human Resources staff, our web administrator, quality liaisons, the Workforce Development Coordinator, and our aim was to increase the staff awareness of new and updated personnel policies. The tools that we've been using, we've used a flow chart, the fishbone diagram, 5 whys, and a Gantt chart.
Thank you for joining us. We really hope you learned something new about quality improvement here at Public Health. Don't forget, submit your ideas for this video newsletter and you could win 1 hour paid time off. We'll see you again next quarter.